All right, everybody, welcome to the Midwest Breast, the best podcast ever. We're super excited today to have Miss Prerna Khemka here from HairSmart. And why are we doing a hair podcast, would you ask, on the best podcast ever? Well, we see a lot of patients who've undergone chemotherapy in breast cancer care, and they go through a pattern of hair loss. I thought it'd be really interesting to talk about hair loss, hair recovery, why it happens, what can patients do. And I'm lucky enough to know Miss Khemka, Prerna, who is the CEO of HairSmart. Prerna, thanks for joining us today.
Thank you, Pankaj. Very nice to be here.
All right, why don't we start by you telling us a little bit about what your experience has been, what brought you here to this role, and why are you passionate about hair?
I have a background in functional medicine and Ayurveda. I'm from India, and growing up, it was very much like, what can you eat for health so that you don't have to cop pills? I moved here when I was 18 for school, and just overall life caught up, and I had a lot of stress-related hair loss in my early 30s. And also, I was in the hair loss industry, and all my clients were hair transplant surgeons, and they all offered to do a transplant on me. But I wanted to see what could I do to heal my body from within, because that's how I grew up. So I was able to bring my knowledge from my upbringing and my functional medicine along with what I'd learned in the hair loss industry here, like what works, what doesn't. And I was able to treat my own hair loss. And I had like really bad hair loss, like triangles. My hair was all the way up to here. And it's hard to imagine me like that because now
Yeah, you have beautiful hair.
but most women across their life, we struggle with hair loss. And while I suffered with my own hair loss and I was in the hair loss industry marketing to transplant doctors, it was very obvious to me that this whole industry caters to men. And women, for the most part, they're taught to their sisters or their friends or their stylists. And that's not really a professional help. So I was able to treat my hair loss with functional medicine, and my very, very passionate about holistic health. So the reason I started HairSmart was because I want people to have a real chance at fundamental, real health from within. Because drugs is always an option, but my belief is it's very empowering to have holistic health that can regenerate yourself, that can reboost your health, and that can get you back to peak optimum health. Because how we look outside is often a symptom of what's going on inside our body. So HairSmart is really like a combination of functional health, metabolic health, and then getting nutrients and getting your hair follicles back into their peak health.
I find hair an interesting representation of what is going on for somebody. I think about our average patient, and they are in a tremendously stressful time frame. Our average patient is not only a woman, oftentimes with family responsibilities, professional responsibilities, but if you then put the burden of a cancer diagnosis, your stress goes through the roof. Stress is a reason for hair loss. Then you put medications on top of that. Chemotherapy is like doxorubicin, the taxanes are known to be causes of hair loss. Of course, hair loss depends on the duration of chemotherapy, the intensity of the chemotherapy, but it's a huge reason where patients come to us. And I think whether they have chemotherapy or not, a lot of our patients struggle with hair loss to some extent. And some studies even report that as many as 100% of patients who undergo cancer treatment have some degree of hair loss. So that's what I see, on the clinical side. It's not something that we've ever really talked to patients about formally, but it's something that always comes up in conversation because I think it's on their mind. It's a physical representation of what's going on in their bodies.
So, when we met in Denver, I was also looking into this. There really are four causes of hair loss. One is genetics. The second is lifestyle. So lifestyle means stress, nutrition, loose cream, how much water you're having, how much fresh oxygen you're getting, all of that. So it's all lifestyle bucket. your hairstyle, your chemicals, how harsh styling you were doing. So genetics is a big one. Lifestyle is the second big bucket. The third one is pollution, which we don't face that much in America, but in countries like India and China, 18-year-olds have wads of hair fall because of pollution.
Wow.
Air pollution, water pollution. And then the fourth one is illnesses, which is chemo, thyroid, PCOS, anemia, even COVID. So these are 4 buckets, but you will be hard pressed to find anybody with just one cause of hair loss. Hair loss is often mixed. Most women, me included, as they are aging, we are having genetic hair loss, women and men. We know genetics has a huge role. But in today's day and age, almost every man and woman, everybody has genetics plus lifestyle-related hair loss. So that's why now we have 25-year-olds, men, with an early onset of genetic hair loss. I always say this in every meeting, every event I ever speak at, that what's happening is modern day lifestyle is causing an early onset of genetic hair loss in men and women, which is why 25-year-olds have less hair than their 45-year-old parents.
That's interesting.
So, and then when you add, for example, your clientele, they are women and they have gone through life, they have gone through several events and they have lifestyle-related hair loss. And then you add the chemo in the mix. So it's basically just adds on top of it. And while we are on this topic, the reason why lifestyle creates hair loss or stress causes hair loss is because the body is a very smart being. So when you're allocating resources through food in the body is going to take everything it has for the critical organs. Hair, skin, and nails are not critical organs, which is why, to your point, the hair tells a story about how your health is. Not just the hair. Anytime your body goes through an event, like a divorce or trauma or a surgery or chemo or a bariatric surgery or even moving or taking the LSAT, anytime your body is going through an event.
Don't tell my daughter about the LSAT.
So your body is trying to take the nutrition where it needs. It's not trying to keep you hair, skin, and nails healthy, which is why the more life events we go through, the less optimum our hair, skin, and nails look. Does that make sense?
Yeah, so another big group of patients that I treat are patients with implants who have autoimmune diseases associated with the implants, breast implant illness, and a common complaint is hair loss. And I think that it goes along with this point that you're making about stress in the body. Now, when I think about the chemotherapy patient, I mean, how does chemotherapy work? It works by impacting rapidly dividing cells, cancer cells. But hair is also a rapidly dividing cell, which is why chemotherapy affects your hair growth. And one of the treatments that we've seen is the use of the cold cap. And so what is the cold cap? Have you had experience with it? And how is that different from the low-level laser therapy?
So great question, Pankaj. So cold cap and the light therapy cap are almost working in opposite mechanisms of action to save the hair and then to regrow the hair. So backing up to the cold cap. The cold cap is a great tool to make your follicles go under hiding before you start chemo. So just to bring it in layman's terms, imagine you are going to be under attack from an enemy. So you want to protect your family, you want to safeguard all your assets and goods. That's what cold cap does. Cold cap forces the follicles to freeze and to hide, which is called dormancy.
Sure, and now they're not dividing, so they're not as susceptible to chemotherapy.
Exactly. That's the cold cap. Now your body is going through chemo, and chemo doesn't distinguish. It's just like a machine gun.
Sure.
So what happens is your chemo induces this turn in hair we call telogen effluvium, which means chemo is going to make all the hair shed. The shedding is called telogen effluvium. So now what's happened is all your hair has shed and it's gone under dormancy. After chemo, that hair may or may not come back. That's one. So the most common occurrences of hair loss or hair recovery after chemo is that Some people experience patchy hair regrowth, so it doesn't grow back completely. Some women experience peach fuzz. The hair has come, but it's not in the same, doesn't have the same strength and bounce and the tenacity to stand. So it's just falling limp. Sometimes curls become straight becomes curly. And then sometimes the hair doesn't grow at all. So all of this is happening because all the hair that went into dormancy didn't awaken because they don't have the energy anymore. And that happens as we get older. We don't have the energy always. All the cells are slowly aging. So what the light therapy does is, the whole purpose of light therapy and the science of light therapy is it improves ATP production. So in the hair follicle, it kicks the hair back into anagen phase, which is growth phase. So it's like there is a seed under the soil which is hiding and it doesn't want to germinate. And light therapy literally is giving it the energy and the food it needs to come back and to sprout new.
So it takes the follicles from dormancy to a more active phase where it's dividing again. That's interesting.
Which is why light therapy doesn't really work if you are actively in chemo. Because
Sure. Right.
with chemo, the body knows, okay, now we are, that machine gun has gone, now we can come out. And that's when you want to support.
So when would one start laser light therapy versus cold cap? Cold cap, as soon as chemotherapy is done, you would stop it? Or how does that work?
Pre-chemo, and even while during chemo, but really it's pre-chemo. And the light therapy is post-chemo. So once you're done with chemo.
Now, a lot of patients are on maintenance medication like tamoxifen, aromacin, Herceptin. These medications have less of an impact on hair loss, but can still have an impact. Have you seen patients who've been on those maintenance medications?
See, in general, when people are cancer survivors and they're on all these different medications, absolutely, their body is going through a lot of trauma. And also their body is also trying to heal. So as I said, they're not going to allocate resources. They're going to allocate resources on fixing the cancer and getting the strength back and making sure all the critical organs are working.
You know, my mom had breast cancer, which is one reason I am doing what I'm doing. And the reconstruction was such an important piece for her. But she had a lot of hair loss issues, and it persisted for years after her chemotherapy. And so it's something that, I saw her struggle with, and it in many ways left more damage than anything else that she went through. So I can understand what a profound impact this has on people.
Because, we did a psychological impact of hair loss in women's research. And chemo or not chemo, hair loss is extremely devastating on women. But now when we're talking about cancer survivors and patients, it's really, really horrible. Like they're dealing with the disease and how their body's feeling and all of that. And on top of it, it feels like a little bit of their dignity gets stripped away.
I mean, for men, being sort of bald is almost in fashion now. You can have hair loss in men. It's something that's tolerable. But I don't think that in our society we're at a point where women are comfortable with any degree of hair loss.
Hair is a kind of like a hallmark of beauty, and it literally frames the face. Like, funnily enough, just before we started the podcast,
I did. Yeah.
I fixed my hair, and I was like, okay, does my hair look voluminous? Because more hair makes us look younger, more desirable, more confident. And there are studies upon studies that connect how you look to your social success, financial success, productivity at work, how many dates you're going to score, how you're going to be viewed by your peers. It's all very well, because how you look is how you feel, and hair is fundamental to how you feel about yourself.
Now, is there research behind the low-level laser light therapy that you can talk to us about?
Absolutely. So this is my favorite subject. I could go on for hours, but low-level light therapy is the most typically studied science for hair regrowth. So we all know there are proven drugs and FDA-cleared drugs, but funnily enough, with light therapy, it's the number one most recommended therapy by hair loss professionals for hair growth at home. And I think there may be more studies since I last checked, but there are 12 human clinical trials done, and the science is very compelling. Light grows hair, and light improves cellular metabolism has been around since 1967. It's something that was found like with the NASA. NASA did some research. So what we're really doing is, the spectrum of light, red light, yellow light, blue light, all these lights have different impacts on the cells. So for example, blue light helps with acne, and red light helps with cellular level metabolism, cellular level respiration. So whatever that cell is supposed to do, red light therapy makes it do it better. So red light is also used for fat melting. It's also used for the skin rejuvenation. So this is the same red light that we are using to dose the hair follicle, which is living under the skin. And we are basically, think about your hair follicle as being like a hybrid car. So you can either dose it with the food you take, or you can dose it from outside. So we are switching the fuel mechanism of your hair follicle by giving it light therapy.
Yeah, this is fascinating. Something I don't really know a lot about. So this is cool to learn about it. So it's a cap that you wear.
Back in the day, so NASA brought red light therapy into light, no pun intended. And then about 20 years ago, the medical industry, the aesthetic industry, it came out with big domes, like big office machines where patients would go and sit under a red light bed to regrow their hair. But obviously it's not convenient. Medicine has to be convenient also, because compliance is a very big part of it.
Sure.
So over the last 10, 12 years, what's happened is the industry has advanced far enough where the technology is now geared towards home use, and it's all about wearable devices. So HairSmart in particular is at the forefront of that. We have created very high functioning, highly advanced, highly powerful light therapy caps, where it's literally like a baseball hat that you wear, and it's only 6 minutes a day. So
okay, 6 minutes total per day.
It's auto-programmed, so you're done even before you know it.
And how long does one have to continue with the treatment?
Great question. So the science of the hair follicle, as we were discussing, has 3 stages. Anagen, which is the growth phase, and then it goes into a resting phase, and then telogen. And after telogen, it has to come back. So anagen is growth, and then catagen is transition, and then telogen is shedding, and then the dormancy. So this cycle is a 4-month cycle. So for anybody to see results on laser cat, they have to use it for at least 3 to 4 months.
Got it.
Any follicle that's in the transition phase, for it to transition out of transition to shedding to dormancy and back to growth, it takes about 3 to 4 months, which is why hair loss is not really sexy, because unlike a really good facial or like a really good skin procedure or skin service, you can't really demonstrate somebody got great results with the cap in one use.
Sure, because it takes that regrowth phase of the different phases of the follicle. It's not only obviously for chemotherapy patients. So this is something that you use on all types of patients with all different types of hair loss. Are there patients who have certain types of hair loss you would not use it on?
Yes. So light therapy, I want to answer it in 2 parts. Light therapy is a very fundamental part of hair regrowth, especially for women in your practice, because you want to put them on something that's local, that doesn't interfere with the rest of their body, with all the drugs they're on.
Sure.
However, in order to really get the best results with hair loss, it's important to do the right supplementation. So, for example, at HairSmart, we are a fundamental believer on the 3-step program. You stop hair loss with the DHT blocker, which all of us have DHT. We all have both testosterone and estrogen.
So DHT is dihydrotestosterone, and medications like finasteride are the ones that are typically used for hair loss, correct? And that blocks DHT conversion.
So we have a drug-free DHT blocker that has herbs that are more bioavailable and don't have the sexual side effects of finasteride. So that is like step 1, you protect. and you want to at least be at a state when you don't have hair loss, so that you can stop further loss. So DHT blocker is important. And then we have something called the H5 Grow Plus vitamin, which has everything you need for your hair, but also for your body. It addresses stress-related hair loss and inflammation-related hair loss, and also has the nutrients for hair growth. So when you have these two and the cat, then it's like diet and exercise. It works like magic. And if you take all three, you also get best results, but you also get faster results. We've had so many success stories of women and men who have gotten results in 2 to 3 months versus 4 to 6 months.
Yeah, hair loss is a tough one because there is a lot of stuff out there. And, this is not my area, so I'm not very well versed in it, but I can imagine it's very confusing because there's all these things that pop up on your social media. So it's hard to know what is effective, what's not effective. I do like the natural piece. I think our practice, we really try to focus on natural solutions, even though they're surgical solutions. I think there's something there that's elegant, that makes sense to people, to try to approach things from a very Ayurvedic, naturopathic direction. So I like that a lot. How do you follow people to see that they've had improvements? Like, how does one assess hair growth or hair restoration?
So you're absolutely right, Pankaj. Hair loss is often a very mistrusted industry because there are so many gimmicky products out there, number one, but also most people are just self-medicating with 1 or 2 things. They don't know how to put a regime together, and it's so important to tackle hair loss from both protect and nourish and growth. And then also a lot of people don't stay compliant. So the reason why people don't see results is A, they're not on a complete program, and B, they don't stay compliant because nobody tells them what to do. Most people are buying something from Amazon or online.
Right.
They buy one serum from one company and one shampoo. And if they talk to a professional who was not misleading them, I will tell them the shampoo isn't going to do anything for you. It's just for hair maintenance. It's not doing anything for the follicle. So really, to treat hair loss effectively, it's so important to see a hair loss professional because otherwise we're all self-medicating with crap we bought on the internet.
I can even say in my own life, I've had times where I've been, very busy, not exercising regularly, not maybe eating the healthiest. I've definitely seen changes in like the density of my hair. And then times when things are clicking and I've noticed changes. So there's no question that there's like a environmental piece to this.
Yes. So, going back to how hair, skin, and nails are an indicator of your peak health, you just basically said the exact same thing. If when you are moving, hair, skin, and nails are the first to go and the last to come back. So when you check every box that you need to do for your health, that's when the hair, skin, and nails come back. Which is why things like HairSmart work, because we may not always be able to check every single box, to eat every single food that we need, to exercise, to do all the things, which is why we need help. Which is why when you treat hair growth in isolation with a functional medicine brand like HairSmart, you can help the hair without having to first check every single box. And it also helps with the body health. But to your prior question, you asked me, so how do we go about getting help and how do you track progress? My recommendation would be to see a consultant. So they can see a hair consultant with you or me. And what we do is we take pictures. We do some virtual program because comfort and convenience is everything. The whole program of hair recovery is at home and it's natural, pain-free, drug-free. So the way we go about it is you do a consult and then we take pictures. We do a program that's recommended for you based on your goals. And then you get on the program and then the consultant meets you every 3 months because sometimes we forget how we looked 3 months ago. So the pictures really help in telling a story.
Yeah, it's a real problem. I see it every day among patients. I know it's on their mind. So, I'm glad that we're exploring these solutions for patients. I do think that like for anything to be successful, you need a process for it, and I think about it in the operating room. You can't have successful surgery unless you've got like a successful process. And I think this is the same. You need to define the process, but it's hard to know what the process is. So it's nice to hear from somebody who does it day in, day out. I think this is great. We're having a seminar with you on November 23rd in our office at Midwest Breast. So hopefully we'll have people attend. They can answer questions. Where can folks find you? Where can they find you on social media or your website?
Yeah, we have a website, myhairsmart.com, and I highly recommend booking a consult with one of our consultants because everybody's story is personal, and we want to make sure you're comfortable and you get all your questions answered. A program for a 25-year-old guy who's looking for prevention and maintenance is not going to be the same as a menopausal hair loss female versus a chemo-induced hair loss or an iron deficiency-induced hair loss. So part of the reason why consults are so important is because we understand what's really impacting your hair loss, and then how to create a program that's personalized for you, and then creating a regime that's synergistic. So a lot of people think diet will make them lose weight. Some people think only exercise, but it's really a combination. So in the same way, we try to create a full system approach, which really works.
Yeah, I think functional medicine is becoming more and more important for patients. We had Dr. Emily on the podcast, who's a functional medicine doctor, and spoke to some of the diet nutrition pieces. And I think this is a way to add to that conversation. So I want to thank you for coming on tonight. You drove all the way from Cleveland. I know that's a big trip and it's later in the evening. So thank you for doing that. Of course. Again, you can find Prerna. We'll put her socials in the link to the video. And again, thank you for listening to the Breast Podcast Ever. And we hope to see you all soon. Thanks.